This is the third case of migraine that is being discussed here. This is a male of 37 years old with mixed migraine and sinusitis since 22 years old. He has recurrent sinusitis. Stimulation of sinuses leads to a migraine attack, and headache usually begins from the left temple, is pulsating and accompanied by severe photophobia. He has a constant postnasal discharge, and he is of the mild type, and he fears headaches, cannot think of anything else except his headache, and always has the fear of a brain tumor. He has had CT scans to rule out tumors, but he is still anxious. This is the normal repertorizing, and we have head pain, temples pulsating, eyes photophobia during headache, eyes photophobia, nose catarrh, postnasal, and mind anxiety, hypochondriacal. And this yields the 10 top remedies of natrum sulph, sepia, argentum, nitricum, phosphorus, kalicarb, nitric acid, pulsatilla, natrum carb, alumina, and causticum. Next we do a miasmatic analysis, and we use these rubrics: headache, face sinusitis, eyes photophobia, nose discharge, and mind anxiety. And this yields the 10 top remedies as we see here: belladonna, natromyl, kalibic, kaliiodatum, bromium, phosphorus, sulfur, mercury, rostox, and hepa. And if we were to cross these two lists, and we will find that there is only one common remedy, and that is phosphorus. And the remedy that was chosen for this case is phosphorus.
You see? So you can confidently prescribe phosphorus in this case. You won't. Okay? Everything clear? Do you understand how we do the analysis? It's very simple. You have two repertories. One is this normal repertory. You find 10 top remedies. Another one is repertorium virosum. You find 10 top remedies. You find the shared ones. If it's one, okay, that's the best result. If it's 2 or 3 shared remedies, then you open your materia medica to find the most appropriate picture. No question.
No question.
No, I was just asking. No questions.
No question.
Ask.
For all these 3 cases,
Yeah.
you only selected one remedy for each. So I would like to know, did all cured or?
One.
For example, like for the first case, we selected iris versicolor.
Yes.
Okay. And what happened to this patient?
Oh, you know, these are successful cases. The reason why I'm not explaining what happened and the case management is that we are focused on understanding the dynamism. You know, maybe in other sessions we can have sessions about case management. Sometimes you begin with, for example, iris. It helps 80%, and you should continue with another remedy according to the picture that comes later. Now, we just want to exercise how to understand the core of the patient for first prescription. That's why. Because it takes a long time and it doesn't help the subject for the description of case analysis, case management. Okay, now the sign and symptoms. If you have a busy practice, these are very typical cases. Some difference in some cases. If you, for example, in 1,000 cases, you see that, for example, 40 cases similar, something up and down, very minor differences. These are the typical cases I've chosen. Okay, signs and symptoms. These are the 4 phases of migraine patient, prodrome, aura, pain phase, and postdrome. You see, we have also a prodromal stage before even aura. This is usually unnoticed by the physicians and sometimes unnoticed by the patient. And after a long time suffering from the migraine, he or she understands this prodromal. I will tell you about the prodroma. Visual aura, I told you, is the most common form of aura. It's usually an unformed flashes and white and or black light, your black spot. These are different kinds of visual aura. Multicolored light. You may see red light, green light, blue light. This is called photopsia in medicine. In your repertory, in the vision color, you can find the related rubrics. Zigzags, seeing zigzag lines. Scintillating scotoma, I told you. Or blurred vision, like our first case. Cloudy vision, as if seeing through a cloud. Smoky. Tunnel vision. There is a you have a limited visual field in tunnel vision, like a tunnel. In which remedy this tunnel vision is? Pardon? Scorpion? Which one is the most famous one for hemianopsia and tunnel vision? Hemianopsia means that 1/2 of the visual field is deleted. A kind of partial blindness. Which one of our remedies has this feature, hemianopsia and tunnel vision? Pulsatilla? Yes, both in the tunnel vision and hemianopsia. We have a, this is very famous in one of our famous remedies. No? No? Aurum metallicum. This is a very important symptom of aurum metallicum. One of my friends in Tehran had a proving of aurum metallicum. He was very brave to do so. And one night he woke up and saw that he has a partial blindness. It was a horizontal partial blindness. He was so scared. He's very, very famous in aurum metallicum. If you open the mathematics of aurum metallicum, this is also always written in black, bold. You know, one of our problems in homeopathic case taking is that the patient describes many things and we think that we do not have these rubrics in our repertory. And so we ignore many peculiar and valuable symptoms of our patient. If you read your repertory, you should read your repertory page by page to know what you have in your repertory. That's why I'm emphasizing on these signs and symptoms. When you know these, when the migraine patient comes to you, you know that there are many things that you can ask to find the peculiarities.
How about geometrical images?
Pardon?
When someone closes the eyes, he sees geometrical images.
Geometrical images.
When she closes the eyes.
We have vision sees, unclosing eyes in delusions. This is not in the vision section of repertory. In mind, delusion, visions, sees, unclosing eyes. The sub-rubric, but specifically that